Welcome to the podcast series Unshakable Strength, Empowering Black Women, sponsored by the Empower Project. The Empower Project is a partnership between Howard University and Health HIV, sponsored by the PACE grant from Gilead Sciences. Girlfriend's podcast miniseries, Unshakable Strength, Empowering Black Women, is dedicated to addressing the unique health challenges faced by Black women and girls, particularly in the context of HIV prevention. We will explore important topics such as sexual health, mental well-being, access to health care, and strategies for HIV prevention tailored to the needs of Black girls and women. We invite you to listen to the other episodes that explore important topics like trauma and health disparities, stigma and cultural understanding for mental wellness, nurturing healthy relationships, and more are already available for you. Today's episode, Prepared and Empowered, the Power of Education, will explore the impact of PrEP, pre-exposure prophylaxis, and HIV prevention and empowerment of Black women. Today, we are fortunate to speak with Leisha McKinley-Beach. She is the founder and CEO of the Black Public Health Academy. She serves as a consultant who provides training on Black health issues, including HIV medical mistrust, racism in public health, cultural humility, and community engagement. Mrs. McKinley-Beach is also an author, thought leader, inspirational strategist, trainer, and community organizer. We also have Afia Wachi Yadam, who is a senior majoring in health sciences and a double minor in African American studies and chemistry. Afia is from Aurora, California. She is a dedicated and ambitious first-generation Ghanaian student at Howard University. Afia aspires to become a medical anthropologist driven by the genuine commitment to women's health and serving underserved communities. I'd like to welcome you both to the conversation. So, Leisha, I'd like to begin with you. What does being in control of your sexual health mean to you? And it's a two-part question. In what ways does PrEP empower women to take control of their sexual health?
Well, first off, thank you so much for having me. And I am truly looking forward to this conversation with you, Miss Whitfield and Althea. There's probably 100 years between my college education and Afia's college education, and we're going to try to bridge the gap between those. But being in control of your sexual health to me means I am empowered to make decisions about my overall well-being sexually. I am able to assess where I am, and I can utilize tools that are available to me to maintain my sexual health. How does PrEP play a role in that? Is very interesting because what we know about PrEP and its ability to keep individuals who are not diagnosed with HIV in that status of not having HIV. But unfortunately, not enough people, including Black women, know about it to add that into my prevention toolkit so I can pull it out when I need it. And to me, about being empowered, that's the first step, knowing what's available to me and knowing how to access it if I choose to. And so as Black women, we start at a deficit here in terms of this biomedical tool.
Afia, I would like to kind of ask you as a college student now, like what does being in control of your sexual health mean? And we can also carry that into PrEP.
Thank you for that question. Again, nice to meet you all. I'm very excited to be partaking in this series. I think a lot of what Ms. McKinley already said is pretty much applicable to me and, my fellow peers in the college experience. I think that being knowledgeable, first and foremost, is very important in terms of what even does like sexual health mean to me. Taking into account of people's sexual orientation is always going to be number one when it comes to me and people's sexual health. And as well as using that knowledge to utilize the resources that are available to you and to having the freedom to make those informed choices about yourself, about your body, about your well-being. I think that, like I said, it's very open to the sexual choice that you have, and also to be free from societal stigma or environmental stigma is also very important to me, because the choice might be there, but if you're in an environment that is very nitpicky about what choices people are making about their own bodies, it does not give you the control of your sexual health, regardless of whether you have the knowledge or whether the resources are available to you. So I think that the society that you are in also plays a very important part. That's what makes it a little bit interesting when you're in college, because I feel like in college, a lot of people understand that it is the time to be expressive of yourself and to fully learn yourself. But that doesn't always mean that it comes with full support, whether it is about your sexual orientation or just your sexual choices in general. It doesn't always mean that just because you're in an environment with people that are in similar age to you that may partake in the same activities that you do or not, it doesn't always have the full environmental support that is free of stigma or, just pointing fingers and stuff like that. So
Thank you. So Leisha, I want to kind of go back to when you were talking about we start in a deficit. How do cultural norms, beliefs, and social structures within the Black communities influence perceptions of HIV prevention and PrEP use?
That's a very interesting question, and I can't wait to hear Afia's response. And let's see if Dinosaur and Young Generation are on the same wavelength on this one. Last week, I was facilitating a conversation with a group of dynamic individuals from Memphis. And we were talking about PrEP and PrEP access. And some of the participants in the group said, you got to go further back. You got to go further back. So we're talking about awareness. And it's like, that's great, but you got to go a little further back. Let's talk about our cultural norms and why we don't see the uptake of PrEP in Black communities, even if everything else was perfect, meaning the marketing, and I know we're going to come back to that, so I'm going to hold that, but if the marketing and access and all of these things created the perfect environment, there's no funding issues, why we still won't see the uptake in PrEP in Black communities is that we're not addressing the cultural norms. And those are things that are included about acknowledging the dynamics between Black men who identify as heterosexual and cisgender and transgender women who have taken on or been groomed by, I like to use this song title, She's Not a Sister, Patsy Cline, Stand By Your Man, right? That we're groomed to do that, right? And by taking on that belief, it means that we also take on some submissive roles as well. And so as we talk about empowering women, that is the ultimate goal, that I feel like I am in the driver's seat about my body, about my sexual health choices. But the reality is, in some communities, especially rural communities in the South, I might be in the passenger seat about my own body. And if we're going to increase that connection for Black women and PrEP, we got to deal with that, right? And so how do we bring Black men who identify as heterosexual into this space that becomes a part of the support system? And we just don't talk enough about the role that the men in our lives play about being able to make decisions about our sexual health.
Thank you. You know, Afia does not know those references that you just made. Right?
Afia, I will bow down to you. If you know Patsy Cline, I'm gonna stop talking right now.
Thank you. So to kind of piggyback off of what you just said, I think that in the Black community, social influence and cultural norms play such a huge part of our identity that it becomes very difficult to ignore it or push it aside when it comes to things like that. I feel like when we talk about biomedicine, there's going to be that debate all of the time, whether we're talking about PrEP, whether we're talking about birth control. There's always a key address to family, to culture, to the society that I feel like always hinders the progression that we're trying to make in those spaces. I think that I'm going to try and make it a larger issue and just really talk about the diaspora in general because I am African. And if this was a conversation that I was having with my parents, it would be a very interesting conversation, regardless of how educated my parents are or how important they see it. It's just there's always going to be that hindrance between the two things because it seems like they just don't really mix well. So over the summer, I had an internship in Nigeria. We went to brothels. We were health educating, talking to them about HIV prevention, about sexual health, and all of those things. And a really huge issue that came up over and over again was the societal, you know, like what are people going to say? That's really what the main issue was going to be. And I feel like if we're going to be talking about those prevention strategies, it's really just the fact that, for one, Black people just don't really like the idea of promiscuity, number one. Even if it falls into sexual health or HIV prevention, it's always something that is going to be an issue when it comes down to family, religion, and just your identity in a community. It's going to lead to moral judgment for the person themselves as well as the community that they're in, just because it is a misconception that it's not for everyone. So if you tell your parents that, oh, I want to be, start birth control, the number one question they're going to ask you is, why are you sexually active? And that may not even be what the conversation is about. It's just that having that knowledge for a young woman and the freedom to want to choose that it's not something that's easily accessible. It's not a privilege that we easily have because there's just such a communal aspect of Black culture that makes health choices very difficult to take, especially when it's an individual choice that you're trying to make. So like I was saying, I feel like when it comes down to like the religious beliefs, it brings in sexuality, which you were just talking about, and how like Black men may feel like this is not, an aspect of medicine that they may be inclined to partake in. It's going to affect Black young women or young Black girls just because, again, they're having society tell them that, again, this is not an activity that you should be partaking in, leave it for the grown folk, if I might say. So it's just all of those things play a part into it. And I just really always try to figure out a way to bridge those cultural influences, but to also understand that when it comes down to biomedicine and the tools that we are starting to utilize, it's really about normalizing those hard conversations and bringing them out of the darkness to address those misconceptions and to have a supportive environment where everybody can feel like they're empowered to prioritize their health, however they might seem so, without like the fear of judgment from their communities, from their families. So that's what's really important to me.
So Carmelita, as I was listening to Afia, I was checking off my own assessment tool, like as a parent, because my daughter is just a few years younger, and she too is a college student at a HBCU. So shout out to Tennessee State University. But as we were going through her journey into adulthood, we would have these conversations, the exact things that Afia mentioned, about birth control, choosing the right tools for her. And even when, she said, I'm not sexually active, and that's great. We don't want to wait till the moment, that you're ready to make the yes. Let's just be prepared. Mm-hmm. And I learned through that process, it made it easy for her to have conversations with me. I'm not making any assumptions. I'm not placing any judgment. I just want you to be ready, right? And so when that time comes, that it is the most amazing 5 seconds. That's for older women. It's the amazing 15 minutes of your life, and you're not thinking about pregnancy or HIV. You really have the opportunity to enjoy that moment. I would like to say that I am in the majority, but I know that I'm not. And it is because of those cultural norms and those social norms. And, without the academic language, it's just so hard for parents to think my baby, even if my baby is 25, like my baby is having sex. But we have to remember, well, how did your baby get here? Right? And so let's prepare your baby for one day when she makes the decision, to become a parent herself, regardless of how her journey may be to parenthood. And so I tried not to stay within those traditional norms of, when girl meets boy, because it might be when girl meets girl, right? We've always used the term partner from the beginning, because whatever journey she takes, she needs to know I can come and talk to my mom about that. So at 12, we started using the term partner. And so Afia just made me create this assessment tool. Like, I did that. Oh, I probably could have did a little more of that, but that's our foundation. Like, that's what has gotten us to this conversation. Because Black women gotta feel I'm connected to this. And I'm jumping the gun because I know we got questions to address that. But thank you so much, Afia, for helping me to validate, I'm on the right parent track.
You're definitely on the right parent track. I can say that just listening to you right now. Your daughter hopefully is in the majority of having this knowledge up front. So I still kind of want to stay around this topic just a little bit and talking about breaking down barriers. What are some of those misconceptions or just the misconceptions that we have around PrEP that keeps us, and why are we not having those conversations with Black women? Like, why are physicians kind of bringing it up to our young women and girls about PrEP?
Well,
so
first
I want to talk about the misconceptions and the myths, but then why we're not really having those conversations around PrEP.
The beauty of this conversation as it relates to PrEP is that for every myth and misconception that we have, there is already a solution available if we would do it, right? So one is that PrEP isn't for women. And every commercial that you see nationally, it validates that. I haven't seen a commercial that is uplifting women as a part of the PrEP journey, and that we are in these loving relationships and holding hands and snuggled up with each other like we see the commercials for other populations. So if you are getting your medical information and knowledge based on what you see on television, and I'll give you a perfect example of companies that probably have made billions of dollars because they have these ads. One of them is the weight management medicines that are out right now. Every 30 seconds, there's a commercial about one of, or multiples of multiple commercials of the weight loss medicines that are out there. And so it does its job. It sends some of us to our primary care provider to say, am I eligible for this medicine, this injection? Because I see the people who weren't jumping and turning cartwheels, and 6 months later, they have gotten to a weight where they can skip and turn 3 cartwheels. Like, that's what I want to do, right? If we had those type of tools available for us on a national level, we would have women going in to see their doctors and asking them about PrEP. What is it? Am I somebody who should be using it? So the fact that myth that it's not for women, that's real, but there's a solution for it, broaden the audience to talk about PrEP through these commercials. And my second myth, because I want to leave some for Afia, my second myth is that this is only for, here's that term again, promiscuous people. If you got multiple partners, right, and and if you having your hot girl summer, you are the one that needs PrEP. And the reality is, if I am just having sex with one partner, the reality is I need a conversation from my clinician about PrEP. And one of the most important groups of providers that are missing the mark with us are gynecologists. Mm-hmm. Right? You don't get more vulnerable with any provider than you do with your gynecologist. And for me, like, that's where the conversation should be, because we missed that opportunity from to be talking to women of all ages. Afia's going to talk about, the young and sexy, and I'm going to talk about the sexy senior citizens, and everybody in between needs to be having that conversation, and far too often it doesn't happen.
Afia?
Yes, thank you for that question. So definitely for me, I think it's very similar as well. It's a huge misconception that those who are at high risk for HIV are the ones that should be using PrEP. So that's going to fall into men that are in homosexual relationships, women or men that are promiscuous, those of the trans community as well. I don't know exactly what categorizes them as high risk. However, for whatever reason, when you are categorized as such, they put you in that bubble of like, okay, well, you have to start using this now. And then I also think a big part of it is definitely representation. Going back to the marketing tools, if I see on my television that the people that are using PrEP are not people that I align with as a person. So if I am a young girl and I see on the television that it is a man in a homosexual relationship, it's not going to click to me that this is also a product that I could be using. So I think that when it comes to marketing, it's very, very important. If we're going to market PrEP as a tool that anyone wanting to prevent HIV should be using, then when it comes down to the marketing and the education aspect of it, they should be using that statement to dismantle that stigma that it's not just for people who are promiscuous or people who are in high risk, quote unquote, that should be using PrEP. And I think that, again, it comes back down to the role of advocacy again, like you were saying, going back to your gynecologist. Not everybody, for one, even has the access to a gynecologist. And then it's also a matter of not everybody, as vulnerable as that space might be, a lot of women are going to their gynecologist with issues. So it's not an open conversation that's being had like, okay, well, I'm not saying I have an issue with HIV or I don't have any pre-exposure to HIV, but let's have this conversation for the future. Those are not conversations that are being had. When you're going to your gynecologist, a lot of the times it is with, I'm having issues with my period. So it's such a targeted and a very in and out kind of visit that I feel like it doesn't leave a lot of room for advocacy on the physician's end or any role of education on the patient's end. And I think that if we can bridge those two things together, it would help with the misconceptions and the myths. And let's really talk about it, like Black women and gynecologists, that whole field is not a field that has been kind to us. If we really want to go all the way back to history, it's not a field that has been kind to it. It's not a field that has advocated for Black women. So even in those spaces, I can definitely understand why there would be some hesitance into opening up conversations about that. I think that something that definitely resonates with me is the idea of promiscuity. Again, I'm African, so things like that do not fly in our community. You are going to be timid. You are going to be very ladylike, whatever that may mean for whatever community. And I think that personally, I've never, even to this day, been in any type of birth control. I'm learning about PrEP as a 21-year-old just because it falls into the major and, the career field that I want to go to in the future. But those aren't even conversations that our parents even understand. They're very traditional. So to them, a lot of the prevention methods that they have is abstinence. And yes, that is a great prevention method. But when it comes down to how our society is moving, people are being they're taking freedom back for themselves, especially with their sexual choices. So it becomes hard to start those conversations with our parents or, with our guardians when we know that they are very traditional people, because it's all a fear of, I don't want to be seen as promiscuous. I don't want to be seen as that girl that everybody's pointing fingers at, even though that may not be the truth. Those are just misconceptions that are very, very hard to approach because it becomes such a communal thing, like I said before, but yeah.
So Afia, I don't know if you could see Carmelita as you were talking about the ladylike model, because that's something that we can share across ages and across the diaspora, that many of our parents taught us to be ladylike. And for me, growing up in a house of faith leaders, that ladylike model was young ladies are made to be seen and not heard. I want you to hear me. I did not take that model to my daughter, because young ladies are made to be seen, heard, and advocate for what it is that they need, and be empowered to break away from tradition. But think about what that has done for women who grew up with that saying, you're made to be seen and not heard. So if I'm not heard, you're not, I don't have that power, or I'm encouraged to talk to my partner about their HIV status, about previous partners, about previous STIs. Like I don't want to run them off, asking those questions, or they may think that I'm the one that's promiscuous because I am initiating the conversation. And those are also those cultural norms that we have to break away from to get us prepared for these types of conversations.
And I think that's one of the things that's really difficult when you're mentioning something like an STI, right? Even before we start talking about HIV, right? You have this new partner, and you want to engage in these conversations, but I can't because I'm afraid, or if I say this, they might think this, right? When all we need to do is just be honest and upfront, like, hey, this is where we are in this. If we want to do this, right, we're still going to use a condom. Right. We're still going to be protected, but let's just talk about, let's have that freedom to have conversations around STIs and have those conversations around HIV, because if we can't have it with each other and you're my partner, then who can I have those conversations with, right? So, Afia, do you have any questions that you'd like to ask Letha? Oh, Letha, I'm so sorry. Leisha?
I really do want to talk about the mistrust of like healthcare systems. I think that we can have as many conversations about this as we can, but when it really comes down to it, how does one, take that initiative? Like, okay, there's a new drug that's going on, there's a new tool in biomedicine that I would like to utilize. How do we kind of start that conversation going, knowing that, again, for Black women, like historically, the whole idea of our sexual health, going to the gynecologist, is not something that has been advocated for us. And there's just a huge mistrust in the Black community and the healthcare system. And I just wanted to talk a little bit more about that.
Sure. And I think that is, an important conversation for us to be had. One, and now I'm going to speak specifically domestically in this country. The medical care system has given us every reason not to trust it. And this goes beyond just the Tuskegee, the syphilis experiment in Tuskegee, because I'm not going to shift the blame to a Black city where the government chose to be. That's another webinar. But even when we look at one of the greatest icons, and I use a lot of her strategy and advocacy, which is Fannie Lou Hamer, somebody who was skilled and knowledgeable, but yet she was not able to prevent a hysterectomy from occurring that she did not consent to, known to us as the Mississippi appendectomy. And so when you start peeling back these research studies and programs and drugs that Black people did not consent to, but our bodies were used in these studies, yes, it gives people pause about, this is new, this is different, and I don't trust it. We got the most recent evidence from this from our experience with COVID, right? Yeah, and so we had people within our community who were willing to participate in non-medical prevention strategies. Stay 6 feet away, wear a mask, stay at home if you can. I will agree to participate in that, but take a vaccine? Oh, no. right? You the first time, shame on you, aka the Tuskegee, the syphilis study. But the second time, shame on us. And so because of that history, there were people who made decisions, right? What we're asking them to do about their own health. And that decision came to getting a vaccine is not what's best for me. Unfortunately, those decisions caused us to lose loved ones that could have prevented death. But the medical mistrust was so real and so present that they did what they felt was best. And so my point from starting there is the message matters, but the messenger matters even more. Because if I don't trust you, I cannot receive the information that you're trying to convey to me about this being the best choice for me. Some of that also goes into cultural humility of folks of our healthcare system not wanting to share the power with those of us who are seated in the role of a client or patient or whatever terminology that you connect with. And I always say to any primary provider that I get that I'm going to be an active participant, that you bring in your expertise as a medical provider, but I bring in my expertise in living with this body my whole life. And so when I tell you that giving me a medication to take on an empty stomach doesn't fare well for my system, and you give it to me anyway, then it's time for me to shop and find a new provider. I'm very blessed to have that option being in a city like Atlanta, where I have a Black gynecologist, female, I have a Black female primary care provider, and I had the opportunity to choose them. Being in more rural communities, those options may not be present. And looking at how do I navigate through this process when I might only have one option or two options in the area. And it is still about educating our own community to be their advocate, and still making the decisions that are best for them. I think that they've got to see more of us, and so it really warms my heart to see your journey in our medical field, because our community has to see more people that they will trust as a messenger, and they trust the message of the messenger.
That's awesome. Thank you. And Afia, as a aspiring medical anthropologist, what are your views on this?
So I really like that question. At first, when I wanted to be in the medical fields, I was going into gynecology. It stems from a lot of personal reasons from my parents, my mom specifically, and just the women in my family. They have always had a issue in childbirth or in their health as a woman in general. But I've always also understood that a lot of the cultural and the societal factors that we think may be separate from the biomedicine are actually not. A lot of it is heavily intertwined, which is what brought me to medical anthropology. So in understanding that, I definitely understand that, like I said before, there's a lot of the cultural, a lot of the social norms that fall into that. And when we are able to not even bridge it, but when we understand that they are interrelated, sometimes they don't even exist. Sometimes there is no dichotomy between the two. When we understand that, it makes it it makes it easier for that mistrust to kind of, to be worked towards, and for that collaboration between patients, between physicians to happen. It really comes back to representation, as you were saying, like that messenger portion is really important, because you can say everything that you want to tell me about PrEP, you can say everything that you want to tell me about it doesn't even have to be about sexual health, about diabetes, HIV. But if I do not resonate with the fact or really just believe that you have my best interest as a provider, it's going to be hard for me to hear. And one of the easiest ways to do that is to increase the representation that we have in the medical field. So it really inspires me when I see my peers falling into their respective, field, their respective career aspirations because they want to be that source of representation for their communities. That's always been really inspiring to me because, Black people, we are the minority everywhere that you can think of, in medicine, in law, in education, all of those things. So it's really inspiring to me to see that. And that's honestly what I strive to be, is to be that representation for the whole of the diaspora. Even if I'm going to be based here in the United States, the United States is full of immigrants. It is full of different kinds of people all over the world that all need somebody that they can value, need somebody that they see themselves in, somebody that they feel like has their best interests. So that's really all that I'm excited for. Another point that I hope we talk about is just how colleges and universities play a part in PrEP education. I feel like it must not be something that's, easy on the pockets. And if we're going to start it, and we're in college, where are we going to get the money from it? So that's always been something that I've been questioning. So just if we could start a conversation about that as well, I think I'd be interested.
So I can jump in here, and I don't want to take us too far off topic, but we at Penn State offer PrEP, and it's at a significantly reduced rate, but we're also going to be offering in the spring PrEPared, which is the bi-monthly injection. So we already have a few students that are lining up to start the injection, but we do have the conversations. I don't think we have enough of the conversations with the students around, because again, there is that I don't want to talk about it, or if you don't bring it up, I'm not going to bring it up, right? And so I think that we do the students a disservice by not giving them all the tools that they can use to make sure that they have good, safe, consensual sex, right? But we do offer PrEP, and it's at a very low cost. And if you have our student health insurance, we can bill your health insurance for it. And then we also have an organization that's right off of campus that offers it at no cost, both PrEP and PEP. So I wish that one of the things that I'd like to do is try to have a full nurses meeting, including our HBCUs in the area, to have those discussions. So and maybe if we can make that happen, that would be something that we could then bring back to the students. But I think my issue is not really an issue, but having conversations with the Black women on campus and getting them to understand the importance of taking a pill every day. Right? Because this is something that you can't just kind of forget to take, like your birth control or something, right? You have to be consistent in taking it in order for it to work. So I think that would also need to be a conversation. And again, representation matters, right? So
yeah, and I think that we will have more options available. You've got the bi-monthly injection. Hopefully in 2025 that we're going to have the 6-month injection available. So that's a great first step. My concern about access to PrEP on college campuses is we will see, as typically what happens is public white institutions will build in structures because they have the resources to do so. And we will see historical Black colleges and universities. We will be referring students off campus. And then transportation may be an issue. And so in Leisha land, PrEP would be available at all student health centers. And the conversation, whether you are at an HBCU or a public white institution, the conversation is about health options for you. And it takes away that stigma of, if you're having sex, you need to choose these options. our goal is for the 4+ years that we have you is to support your overall health. That, write it down. That's a campaign slogan for every college, right? And on that journey for your overall health, it might be sex, it might be weight management, it might be mental health, but whatever those things that help to make you whole, we are here to help you and to support you as you navigate that system. But we don't hear that. We don't hear that often enough. We don't see it often enough. And unfortunately, with the population that we are addressing, it's not available often enough on campus.
Afia, do you have any other questions while we have Leisha here with us?
Honestly, no. I think that this conversation has been very proactive.
Mhm.
I think that it's been very inspiring as well to just see how all of the different aspects of it come together. I really hope that this is something that Howard can implement. I mean, we do speak about it. We talk about HIV prevention a lot. We talk about PrEP a lot, but just more, like you were saying, giving it a more on-site approach. That way, it's a little bit easier for those that may have transportation issues. Having it be integrated into the student health insurance as well would be definitely helpful for those students that may not have, insurance elsewhere. So I think that been a very productive conversation, and I'm excited and I'm very thankful that I have been able to be a part of it. I definitely learned a lot as well. So I appreciate the opportunity.
Well, thank you. Well, thank you all for tuning in to this episode of our podcast. We hope you found the conversation engaging and informative. If you found today's episode engaging and we encourage you to tune in to our upcoming episodes covering topics like Black women navigating life, professional spaces, and barriers, and health and wellness for Black transgender women. Remember to subscribe, rate, and review our podcast, and help us to reach more listeners. Until the next time, thank you so much.